thanks, Gene. I'll introduce Gene Dolgoff. Is that right, Gene?
Yes.
Okay. Gene, you're the founder. He's the founder and CEO and CTO, chairman of Holobeam Technologies. He's a physicist, engineer, and inventor. Was a former member of the Phonar Corporation development team that developed the MRI, developed holographic ultrasound and X-ray medical technology. Inventor of HET, holographic energy teleportation, advanced nanoparticles, the Holo-X X-ray system, the holothermia treatment protocol, the LCD projector, holographic transfer printing used on credit cards, the US HDTV system format, the instant 2D and 3D converter, a holographic video projector, ANCI digital projection standards, a cloaking device, the Star Trek holodeck, and was the founder and CEO and CTO of Project Vision Inc., a NASDAQ publicly traded company, the world's first LCD projector company. Mr. Dolgoff taught optics, lasers, and holography at the City College of the City University of New York and authored the text used. He has published various articles and technical papers on holography, 3D technologies, and the brain, and has over 65 patents worldwide. Wow, that's a very impressive resume, Gene, and we're looking forward to hearing your presentation today.
Thank you. Can I start?
Yes, you.
Okay, very good. First of all, I'd like to apologize in advance because I have a lot to tell you in a short time, so I'm going to go quickly. So let me hit the next. Okay, and this is my company, Holobeam Technologies, and we are developing some very radical new medical devices for diagnostic imaging as well as treatment of various diseases. Did you know that last year in the U.S., 1.7 million new cancer cases were developed? There were 600,000 new cancer deaths. 1 in every 2 males and 1 in every 3 females will get cancer. 1 in 5 children with cancer won't survive. And there were 12 million dogs and cats together that died from cancer. Now, you may be saying, oh, gee, that's terrible. And now, okay, let's move on. So it's not really having much of an impact on you, but it should have a big impact on you. And I'm going to try to have you have a bigger impact, a bigger reaction to these facts, because, you know, anyone can get cancer, including you and your loved ones. And it's not very pretty. It's bleak what happens. So when cancer hits you, it feels like really like a ton of bricks has fallen on you. It is so devastating. And people die around you as the years go on from cancer, and they suffer. And it's a terrible thing. So there are about 200 types of cancer. Well, the fact is that 40% of the people that come down with cancer will die within 2 years, no matter what they do. That's a fact. It could be you or your loved one. And of the surviving patients, 50% of those will have the cancer recur, even though they've had treatment, and the treatment may have made you think, oh, I've beat it. That's pretty bleak. And then those of you that do get treatment will have side effects that you'll tolerate, but there'll be trauma, and you'll find that it's a terrible experience. Now, recurrence rates vary widely between cancer types, and within the cancer types, the recurrence depends on what stage the cancer was in when you discovered it, what the histology is, your genetic factors, various other patient-related factors, and what treatments you have. For instance, soft tissue sarcomas recur in approximately 50% of patients after the chemotherapy, and for most patients who are diagnosed in late stages, the rate of recurrence is 100%. So look at some of these numbers. Bladder cancer recurs 50% of the time. Lymphoma can recur up to 75% of the time. Ovarian cancer, 85% of the time. Prostate cancer from a quarter to 50% of the patients. 30% recurrence in breast cancer. 100% recurrence in glioblastoma. Up to 50% recurrence in Hodgkin's lymphoma. And osteosarcoma, 45%. And similar with the pancreas. So recurrence is happening a lot. Now, why is there recurrence? Well, the main reason is the cancer is made of tiny cells and tiny little cancer stem cells, and all you need is one. And if you do treatment and it doesn't get all of them, which it usually doesn't, then it's going to travel somewhere in the body and it'll take up residence there and start growing. Now, for instance, if you have lung cancer and they treat it and you think it's gone, meanwhile, it could travel to the bones. And then when it starts growing cancer there, you got cancer in your bones, but that's actually lung cancer in your bones. So wherever it goes, it'll start growing again, and it'll go in many places, and eventually it'll damage too many organs, and that's metastasis. And that's what kills almost 95% of the patients that die from cancer, is metastasis. So why does this happen? Let's take a look at how cancer is treated. First line of defense in what's called the gold standard is surgery. You know, they try to cut out the cancer, but the problem is you can't tell by looking where the cancer ends and where the healthy cells start. So, you know, they try to cut out more than what appears to be the cancerous area, but they don't get it all that way because you can't see what you're doing. The cancer cells are so small. Also, next step is chemotherapy. With chemotherapy, they take a poison and they inject it into your veins and get it circulating throughout your body. And they give you as much poison as they can without killing you. So you're not going to feel very good while you have this poison in you. In fact, less than 1% of that poison gets into the cancer cells. The rest, of course, goes to all the healthy cells in your body. So it creates a lot of side effects. So your hair falls out. You feel nauseous and worse. I mean, it's a terrible thing. And very often, they don't have the right chemotherapy for your particular cancer, your particular body, your particular genetics. And it's hard to know. So they just do trial and error. And they have to wait for weeks or sometimes months to see, did it do anything? If not, okay, they'll try another one. It's a brutal way of trying to solve this problem with chemotherapy. Then after they do chemotherapy, they want to make sure they got it all, so they do radiation therapy. And with radiation therapy, they're sending beams of X-rays into your body. And sure, as you can see in this picture, the beams overlap at the cancer, and so the cancer gets the highest radiation dose. However, as you can also see, lots of healthy tissue gets the radiation too. And actually, it's not usually 2 beams. It's usually a lot more beams. So a lot of healthy cells get the radiation, and therefore they're damaged, and that's permanent too. So that's another side effect. And then there's the newest line of defense, which is called immunotherapy. And there are various different kinds of molecules, including what are called monoclonal antibodies, are sent into the patient with the aim of stimulating the immune system of the patient so the patient's own immune system can kill the cancer. This actually works and kills cancer sometimes, but not a lot of the time. There's not a lot of patients that this is working on. And one of the main reasons for that is it's an individualized therapy. So it takes time and it's very expensive. Most patients will not ever get access to this kind of a treatment. So with cancer treatment, you have side effects of all kinds. You have a reduced quality of life, a reduced length of life. There's usually financial hardship unless you have good insurance, and there's hardship for relatives as well. The bottom line is no treatment exists that works consistently on cancers. Also, there's viruses. Viruses are deadly for many, many viruses. You may not know that there are over 1 million viruses, and only about 5,000 have been classified. And there are vaccines for less than 24 viruses. It's very difficult to create a vaccine for a virus. And all of these problems will produce a reduced quality of life, side effects, reduced length of life, financial hardship. And then there's more. You should be afraid by now, I hope, of getting this. And you really can get it. 1 out of 2 men and 1 out of 3 women will get it. So your chances are not so good of escaping. And the treatments are not so good. So let's talk about antibiotic-resistant bacterial infections. Many of these infections are now becoming antibiotic resistant. For instance, gonorrhea, tuberculosis, MRSA, scarlet fever, salmonella. And these are increasing in number of the people that it kills. And the WHO says that by 2050, there will be 10 million deaths worldwide from antibiotic-resistant bacterial infections. And what can be done about it? Another thing that happens is, and this happens in the hospital, when you go to the hospital once you've got an antibiotic-resistant infection, or if you have cancer, you have to go to the hospital, or a virus that's not being treated and successfully. So your body could have an immune response which is so strong it starts to affect your own organs. This is called sepsis. Believe it or not, sepsis accounts for 1 in 5 deaths worldwide. This is from your body attacking itself to try to deal with that virus. And it goes very rapidly. Over 11 million deaths annually worldwide are from sepsis. And people in the hospital, 1 in 3 deaths are due from sepsis. So let's take a look at what's going on. How does the immune system work? Well, the immune system sees a foreign invader come in, and it starts taking proteins and throwing them together in all kinds of different combinations. It's like throwing spaghetti at the wall to see what's going to stick. And the antibodies are formed when these proteins turn into some kind of a combination that might find and stick to the invader. So, let's say it's a bacteria or a virus or a cancer cell. The immune system is going to create all these antibodies. Eventually, it will find a formulation that will find and stick to it. It always does. It's really an amazing system, and it creates what's called an antibody, which finds and sticks to the invader. But, that doesn't help you. What has to happen next is the antibody has to then call the immune system to alert cells like white blood cells, T cells, B cells, natural killer cells, macrophages. Send all of these cavalrymen to come and now kill the invader that it is attached to. But you know what? It usually doesn't work. That's why we get cancer, we don't spontaneously get better. We get most viruses, doesn't get better. I mean, look at HIV, for instance. When that came out, they thought, in 2 years, we're going to have a vaccine for it. It's 40 years later, there's still no vaccine against HIV. And the same with antibiotic-resistant infections. Our body can't take care of it. So we have a new approach that can handle all of these: cancer, viruses, antibiotic-resistant bacterial infections, and other diseases as well. At Holobeam Technologies, we've been working on this for 40 years to make this solution work. And we finally made a breakthrough that made it possible in 2018, which is when we incorporated. Our unique approach is this. We infuse the patient with what we call advanan nanoparticles. That's advanced nanoparticles, which include these special nanoparticles that we developed that are attached to monoclonal or polyclonal antibodies to target the invaders. And we're using the monoclonal antibodies, which are just antibodies that your body already produced against that particular invader, that we take out and clone and then put back in. So you know they're not going to hurt you, and they are going to find the invader and attach to it. But they're not going to do any better than the antibodies normally do. They're not going to cure you. But we're not using the antibodies in the form of monoclonal antibodies or polyclonal antibodies to cure the disease. We're only using it for what it's good at, which is to locate the invading pathogen and attach to it. That's all we want. And it does that really well. Once it attaches to the invader, we then send external energy from a machine. We are developing these products that put out the energy, and that energy goes to the nanoparticles and causes the nanoparticles to heat up. And now the nanoparticles are already attached to the invader, to the cancer, to the bacteria, to the virus. So this is safe and it's effective because it's not relying on the chemistry of your body to kill the invader. It's relying on the energy we send in. This is what an advanan particle looks like. You see the monoclonal antibody attached to the nanoparticle. So our unique approach has a lot of different ways that it can help the body and kill whatever the invader is. So for instance, in surgery, well, now we're going to have all the cancerous cells, for instance, attached to our nanoparticles. So our scanning machine will detect those nanoparticles, and therefore you get an image of where the cancer cells are and where they're not. So when they're doing the surgery, now they know where to cut and where not to cut. In chemotherapy, what we can do is take the chemotherapy molecules, the poison, and coat them with a protective inert coating and attach them to our advanan nanoparticles. Now, when they go into the body, they don't do anything because they're protected with a unique coating that keeps them from harming the body. But they are now dragged along with the monoclonal antibodies to the invaders, to the cancer cells, to the virus, to the bacteria, and they now attach there. And now when it gets there and we send our energy in, the energy dissolves the protective coating on the chemotherapy, releasing it only into the cancer cells. So now we use a lot less of the chemical. We don't get the poison into the healthy cells in the body. And now we have targeted destruction of the cancer cells or other invader. With radiation therapy, we have some unique advantages as well. The way that radiation therapy works is it causes ionization. It's called ionizing radiation. And what that means is the X-rays hit the outer electrons of the oxygen atoms and cause them to fly off, causing the oxygen atoms to be ions. And these are free radicals that start destroying the tumor. However, there's not a lot of oxygen cells, molecules in the tumor because tumors don't need much oxygen. They're anaerobic. So that means the radiation is not as effective as it could be if it wasn't a cancer cell. But we can, with our process, heat up the area by sending our energy to the nanoparticles, which then causes the blood vessels to dilate. That increases the blood flow and increases the amount of oxygen to the tumor. So actually, it makes the radiation 3 times more effective. So it helps the radiation therapy work. Also, the tumor itself is now receiving all this energy, and as you'll see in a minute, that energy is not going to harm the healthy cells. You'll see why in a moment. Now, we also can use the fact that we heat up the nanoparticles within the tumor cells or virus or bacteria, and that's called hyperthermia. And that heat can destroy those invaders directly. So that's another thing we can do. And another wonderful thing that happens when we use this technique to heat up through the energy heating up the nanoparticles, heating up of the invader, like the cancer cell, it causes the release of what's called heat shock proteins. And these proteins are specific to the type of invader you have. That means that the body will then be able to recognize those proteins and mount a defense and create antibodies against that invader. It's called autologous immunization. So you are creating your own immunization, which is specific to your type of invader, which can be more successful than externally applied medicines that are sent in, like vaccines or treatments. Now, this all sounds great, and that's why we were working on it for decades. But we saw there was a really big problem. The big problem is when you send energy into the body to heat up the nanoparticles, it also heats up water. So since your cells are mostly water, it heats up the cells that are healthy. That's no good. So we had to find a way to get that energy to the nanoparticles and not go through the healthy cells, somehow get it in there magically. And we finally found a solution. And that was through the field of holography. Holography allows you to take waves and overlap them in really complicated, specific ways that can be calculated and done on a computer so that the waves cancel each other out, just like in noise-canceling headphones. And we can arrange it so it cancels each other out wherever we want, which means we can cause the energy to cancel each other out everywhere in the body except at the nanoparticles. Wherever those nanoparticles are, that's where we don't cancel it out. Therefore, the energy only appears at the nanoparticles. And this means that the healthy cells are not seeing any energy. This process, or this technology, is called HET, for holographic energy teleportation. It's using holography to cancel the energy everywhere within the body except at the nanoparticles. So if there's no energy going through the healthy cells, there's no damage, and therefore no side effects. Now, we've taken this very far, and I just want to give you a quick demo of how it works. Here is a tank of water, and what we have all around the water are these solenoids, which are simply electrically controlled magnetic water beaters. When you send a current to it, the magnet pulls the rod down, which hits the water and creates waves. And all of these are connected to a computer. So by causing them all to hit the water at the right times, we cause the waves to overlap and cancel each other out everywhere except where we want. In this case, we wanted to outline an area in the shape of an S. So you see, it looks like the water is flat everywhere else. You can tell this by the reflection of the window in the water. And yet the water raises up where the energy is in the middle. So imagine that was your area of cancer. That's the only area that's getting the energy. And meanwhile, all the rest of the areas where the rest of your body is seeing no energy. This is HET. We have already proved this. We've used it to cure cancer in mice. Here's an example of a tumor. 2 weeks later, it's just about gone. Within a month, the tumor is gone. We've also cured cancer in dogs. Here's an example. Here's a pretreatment tumor, and we then use the process, And within about 2 weeks, the treatment was done and the transformation began taking place. Now, just naturally in the healing process, you see in 3 weeks how it got much better. Within 6 months, it's totally gone. These dogs were totally cured. The cancer never recurred, never came back again. We are now working to raise the money to develop our systems, our machines, to do this with people. And again, this can work on cancers, this can work on viruses, this can work on bacterial infections, fungi, and any type of invader, parasites. So we are developing 3 products. Our first product is called HoloX, and it should be out at the end of this year. It's a much more advanced X-ray system. Basically, when you go to a hospital or a doctor's office or take your pet to a veterinarian's office, they have an X-ray machine. It's simple, and it's one shot. It's not a lot of radiation, and it gives you an image of the inside of the body. But the problem is everything from the front of the body to the back of the body is squished down into one picture. Everything is on top of everything else. And where there's a lot of overlap, you can miss pathology. You can miss a pneumothorax. You can miss pneumonia. You can miss a hairline fracture. There are many things that you can miss. And plus, misdiagnoses take place, which means treatment of something that isn't there. But what's worse is if you don't see something, and then you don't say, well, let's confirm with a CT or an MRI scan, because you don't see anything. And then they discharge the patient. Days later, they have to come back because it's gotten worse. And now they are in trouble because they have not properly diagnosed the patient, and they may not get reimbursed. Also, there may be lawsuits. So that's the difficulty with the regular X-ray. Well, with HoloX, it produces a 3-dimensional image with planes of data, similar to what you see in a CT, floating in midair in front of the monitor, no goggles needed, no 3D glasses needed, and you can move your head and look around the different layers and see hidden features, see the hidden pathology. You can see behind the ribs that there was nodules that are cancerous. You can see the calcification within the arteries. And this is all with one exposure, low dosage. The device costs a tenth of what a CT scanner costs. And the exposure to radiation is as little as 100th of the dose that you get it with a CT scanner. So that's HoloX. We expect it out at the end of this year. Then we're building what's called the HET MRI scanner, or we call it MRI 2.0. We have a lot of the members of the original team, which I was on, that invented the MRI back in 1980. With this new scanner, we have some major advantages over conventional MRI. Number one, instead of that tremendous noise that you hear in an MRI, it's silent. Instead of lying in a tube, which creates claustrophobia, and you have to be motionless for 30 to 45 minutes, the scan takes a fraction of a second. And that means you can take continuous scans and create MRI video, which is very useful, including allowing us to monitor treatments like cancer treatments in real time and see if the treatments are working or not, and not have to wait weeks to find out, or months. So that's very valuable to have at such a short exposure time. And then also the resolution is much higher. Today's CT scanners and MRI scanners have a maximum resolution of about 1 millimeter. That means anything smaller than a millimeter can't be seen in these scanners. Like a cancer, which starts out as an individual cell. Well, with our new MRI 2.0, the resolution we can get is 7 microns. So we can see individual cells, and we can.
Sorry to cut you off, Gene. It looks like you are going a little bit over.
Okay, I'm just about done.
Okay, perfect.
Okay, so So with the high resolution, we can detect cancers early, which allows us to cure it. Also, instead of a flat image, which we get in today's MRI and CT scanner, we get a three-dimensional image that floats in midair. And for the first time, these scanners not only detect disease, but also can be used to treat the disease using HET, as we just talked about. So this is a real breakthrough. So that product will be available in 2 years. And then in 3 years, we're going to have our portable HET scanner, which does all the same things, but it's portable, runs on batteries, can be put in an ambulance or a tank or whatever. So what we're doing now is we're selling stock in our company to raise the funds to finish these products. This is Holobeam Technologies, and I thank you for listening.
Wonderful. Thank you so much, Gene, for your insightful presentation. Just one quick question, if you want to quickly answer, from Simon from Occutrex Vision Technologies. He's
Sure.
asking, do you expect to see great resistance to this solution by the pharma industry with a vested interest in their highly profitable chemotherapy drugs?
It's an excellent question. And the answer is, I don't think so, and I'll tell you why. As I mentioned before, this will help chemotherapy and radiation therapy to be more effective and safer. So those products that they use will just be better. We're not knocking them out. We're making their products better. And plus, we're going to take our technology and license it to those companies, the ones that make that equipment and those supplies, those medications. We're going to license it to them so they can make money and they can sell it to their established networks.
Perfect. Again, if anyone has any questions for Gene after the program, you can email it to us. And again, we appreciate your time again, Gene.
Thank you so much.
You're welcome. So it looks like we will be heading over to our next session by David Williams. We'll be speaking about